Let's continue our exploration of evidence-based treatment approaches and practical strategies for working with individuals exhibiting obsessive traits. This is sure to be a valuable lesson for all of us as aspiring psychologists. In our previous session, we delved into the key characteristics of those struggling with obsessive tendencies, from a heightened need for control to debilitating perfectionistic urges. Now it's time to equip ourselves with the knowledge and tools to effectively support this population. So let's get stuck in, shall we? As I mentioned last time, obsessive traits exist on a spectrum, and not everyone who exhibits some level of perfectionism or routine-based behavior would be classified as clinically obsessive. However, for those whose obsessive tendencies significantly impair their quality of life, there are a number of evidence-based treatment approaches that have proven successful. In this video, I'll be outlining some of the most effective therapeutic interventions, as well as practical strategies you can implement in your future clinical practice. By the end of this session, I'm confident you'll feel better equipped to provide compassionate, tailored support to individuals struggling with obsessive behaviors. Let's start by discussing one of the gold standard treatments for obsessive compulsive disorder, OCD, a condition closely linked to obsessive traits. Cognitive behavioral therapy, CBT, and more specifically, exposure and response prevention, ERP therapy, has been shown to be highly effective in managing obsessive thoughts and compulsive behaviors. ERP therapy involves gradually exposing the individual to their feared stimuli or obsessions, while preventing them from engaging in their usual compulsive rituals. This helps to break the cycle of obsession and compulsion and ultimately reduces the individual's distress. A 2018 study found that around 70% of OCD patients experienced significant symptom reduction after undergoing ERP therapy. Another valuable approach is mindfulness-based interventions. By teaching clients to observe their thoughts and feelings with non-judgmental awareness, we can help them develop a healthier relationship with their obsessive tendencies. This can empower them to respond to intrusive thoughts with greater flexibility, rather than getting caught in rigid, compulsive patterns. It's also important to consider the role of medication in treating obsessive traits. Research suggests that selective serotonin reuptake inhibitors, SSRIs, can be an effective complement to psychological therapy, particularly for individuals with more severe symptoms. However, it's crucial to work closely with a psychiatrist to determine the most appropriate pharmacological intervention. On a practical level, clinicians can support clients by helping them establish healthy routines and coping strategies. This might involve creating structured schedules, practicing relaxation techniques, and encouraging balanced, self-compassionate thinking. The goal is to equip the individual with the tools to manage their obsessive tendencies without becoming overly rigid or controlled by them. Now that we've explored some of the key evidence-based treatment approaches and practical strategies for working with individuals exhibiting obsessive traits, I encourage you all to continue researching this important topic. In my next video, we'll delve into the role of empathy and validation when supporting this population. Stay tuned, future aspiring psychologists!